Hi, it's Dr. Brian Heaberlin here with Lexington ENT and Allergy, and I wanted to talk about thyroid and thyroid nodules. The thyroid is a gland in the lower part of our neck that we all have. It's about 2 inches tall, about 1 inch wide, about 1 inch thick on each left and right half, and there's a little band of that tissue that goes across the trachea. And this is in our lower neck, just below the thyroid cartilage or the voice box. The thyroid gland secretes thyroid hormone, which is partly responsible for our metabolism. So people with underactive or overactive thyroid glands can have some metabolic issues. And so as otolaryngologists, we often get asked to evaluate people that have nodules in their thyroid gland. Those nodules can be discovered on just physical examination, where someone feels a nod or a lump in the lower part of the neck. Or more often nowadays is they get discovered on other types of imaging studies. So for instance, someone may get a chest CAT scan for a chest condition and they see a nodule on the lower part of on the thyroid gland, which is kind of seen on the upper part of that chest CT. And so we get asked to evaluate those nodules. Most thyroid nodules are benign, and thyroid nodules are actually very common. As many as 50% of people have nodules in their thyroid gland, and most of those are innocent and don't cause any real issues or problems. So someone that has nodules that are discovered, we like to get some thyroid function studies to see if their thyroid is working properly or if it's overactive or underactive. Overactive patients, or patients with an overactive thyroid that have nodules, kind of require a little bit of a different workup than most people who will have a normal functioning thyroid with those nodules. Most often those nodules are part of what's called a multinodular goiter, where there's more than one nodule, but sometimes it's a unifocal nodule. So patients with thyroid nodules, we will most often get a thyroid ultrasound, because that's the best study to accurately measure the size of the thyroid gland as a whole and the size of the nodules, and really document all of those nodules that are present within the thyroid. The thyroid nodules often require an ultrasound-guided biopsy if they're a certain size. So small nodules can just be watched and observed with serial ultrasounds, but some of the medium to bigger size nodules will require an ultrasound-guided biopsy. And an ultrasound-guided biopsy is a very simple procedure done under local anesthetic, where a small needle, usually 25 gauge or smaller, is directed into the nodule, and they watch it go in on ultrasound, so they make sure they get it into the right area within the thyroid nodule, and they just draw what looks like a couple drops of blood, but a small sample of that thyroid tissue out that the pathologist can then examine and try to determine if it's malignant or cancerous or benign. Most of these fortunately turn out to be benign. Patients with thyroid nodules, 90% or so are going to be benign. And in those benign conditions, they can sometimes grow and sometimes need to be removed if they continue to enlarge, but in most cases can just be observed and not ever have to have surgery or remove the thyroid. So in summary, thyroid nodules are common. They do require some workup and examination to make sure they're okay, but fortunately in most cases turn out to be all right. If you need thyroid surgery, you want to go to someone who does a fair amount of thyroid surgery. There's been studies that show people that perform more thyroid surgeries are more likely to or do better with less complications. So if you have thyroid conditions, we're very happy to take care of you here at Lexington Ear, Nose, and Throat and Allergy. But we'd like to see if there's anything we can do to help out. Thank you.